The types of cancers we treat are malignancies that involve the brain, spine, or peripheral nervous system. Those are usually either so-called primary tumors that start in the brain or spine, or there are secondary tumors, otherwise known as metastases. These are malignant tumors that have started elsewhere in the body and then secondarily spread to either the brain or the spine.
It's very important when you get diagnosed with cancer to get managed and treated in a cancer center. Cancer center is different than a physician office, than one person, a surgeon, regardless of his or her expertise. It requires a multidisciplinary approach. It requires a big team. We are fortunate here at the Lefcourt Family Cancer Treatment and Wellness Center to offer this team approach. From the first time that you get to the cancer center, you will be taken care by nurse navigator, by a myriad of cancer services that are all focused about you and on your care.
We at Englewood were one of the first in the region to apply radiosurgery, which is otherwise known as SRS, not only to brain tumors, but also to spinal tumors. And it's proven to be very, very effective in patients who are candidates for this type of treatment.
Stereotactic radiosurgery, simply defined, is using a three-dimensional framework, which is what stereotactic means, in order to treat a patient's brain tumor. Since tumors can be identified so accurately, we can identify the areas that are needing treatment. Therefore, the areas outside of the area that needs to be treated are avoided, and side effects can be avoided completely.
We want to limit the amount of radiation that can get to these very important critical tissues around the tumor, but still be able to give radiation to the tumor itself. If someone were to say to me, they've been advised to go to New York City for their cancer treatment, I'd say there's really no need. First of all, the quality of treatment that we offer here in Englewood is unparalleled and matches or even surpasses that which is provided at the major medical centers in New York City. I can't think of one treatment that would be offered anywhere else that we don't have access to and that we provide on a daily basis.